I'm very excited that we're able to do this tonight, because this is something that I am currently going through menopause. I think I'm on, my last period was in May. So this has happened before, and then like a month from now, I'll get my period. So we'll see. But, you know, understanding this transition, I think, is really interesting. And I think that the metrics I've always used to be indicators of my health are not the same things I need to use now for many reasons. But, and so I'm grateful that we can talk about how balancing muscle and fat and water can change how you feel. So I'm really happy. So joining us tonight is Dr. Jing Liang. She is a physician, and I know her through the orthopedic sports medicine world. She was a good partner in treating a lot of our pain management patients. So I'm going to let her tell her story here in a minute. But I think understanding the body the way that she does from a pain management standpoint is what makes her so good at this functional medicine side, because the way that she's had to regulate the pain system is very similar to managing these transitions in life. So I'm really grateful that Dr. Liang, you joined me to do this. And this topic actually came up between the two of us about these InBody scans, is because just using a regular scale to measure your body fat or to measure your weight, your body mass, is deceiving, I think. And women tend to use the scale as an indicator of health. And I think that understanding that health is more than just a number on the scale is how we can start empowering ourselves that we are actually in control. So thank you for doing this with us tonight, Dr. Liang. So if you want to just take a moment and introduce yourself to everybody and, you know, tell us your story.
Yeah. Well, thank you, Denise. That was a very nice introduction. Very flattered. Also really grateful to been working alongside with you for actually, gosh, many years, right? Back in the days of Crystal Lake. So
yeah, I worked for a big corporate place, so.
So was I.
Yeah.
So I of the community in McHenry, you know, Crystal Lake and McHenry and Huntley, you've known me as this interventional pain management doctor for many years, but I've also done a lot of rehabilitation because that's my background. So I'm board certified in physical medicine and rehabilitation, and hence that's why I'm so familiar with what physical therapists do and what occupational therapists do. We'll always work as a team to really help the people going through their functional deficits, get them better, understanding what their goals are in the physical medicine world. And with the interventional pain medicine, what I have been trying to do all my life is to relieve their symptoms and give them the opportunity to do their rehabilitation and kind of get them over the hump. That's the way I would explain to most patients. And what I find in many years of practice is that we focus on body parts that we feel pain and discomfort, and of course, functional deficits. I have pain in certain areas, so hence I cannot do this. I cannot pick up my grandchild. I cannot vacuum. It's difficult for me to take a walk to exercise. As I dealt more and more and seen more and more thousands of people over the years, I realized that there's an underlying root cause or causes that patients have, and that's why they have all this inflammation and it manifests in their musculoskeletal system. So where I've been kind of dealing in the orthopedic world, where I would treat one body part, I kind of expanded the lens into looking at the whole body. So what is someone's stress level like? Do they have a overdrive in their sympathetic response? Is their gut health not optimized? Is there a hormonal imbalance? And that's very applicable to tonight's talk, because as we are going through our perimenopause and menopause years, there's a lot of fluctuations in all different type of hormones, and that fluctuation eventually will catch up to us with, years of accumulations of gut health imbalance, and maybe toxin exposures. So I decided about 2 years ago that I would pivot from my conventional medicine practice to do root cause medicine and as well as movement medicine. And that's why I started Wellbridge. And this is where I am all by myself, not part of a corporation, to really, and I would have the freedom to really look at the person as a whole. And I'm not constrained by the rules of the corporation or the insurance companies. I would have free reign on whatever I feel is right to treat the patient and get the patient better back to their functional level, back to their expectations of themselves, and really try to be the best version of themselves.
Well, that's great, because I feel like the way medicine has been going, it's like you have a couple minutes with the doc, and some of these docs don't understand what women are going through, and they don't really care to expand on it. And they look at a couple panels and they're like, your blood pressure is good, your whatever, your white blood cells, your cholesterol, everything looks good, you're fine. But a lot of us don't feel fine. We know something's changing and something's different. We don't feel fine. We have aches and pains where we didn't. We're putting on weight in places we didn't before. And it's nice to have people like you who actually have time now, because you're out of that corporate system, to listen. And I think that's the biggest thing that you offer, is that you listen. And you have time now, whereas in your old system you had a few minutes with each patient. So I appreciate that you've prioritized what patients need and deserve over, I just got to get this patient out because I got to get the next one in. So, well, okay. I'm grateful you're here. And I'm Denise Smith, for those of you that I haven't met yet. I own Smith Physical Therapy Plus. We are a physical therapy clinic in Crystal Lake. Our emphasis is on individualized treatment, and similar to what Dr. Liang was saying, when we look at movement, we see dysfunction, and our whole goal is to keep everybody moving. And I think when you're going through perimenopause and menopause, it's easy to just feel aches and pains, or weird things might start cropping up, like all of a sudden your shoulder isn't moving the right way, or you've got developed plantar fasciitis where you didn't have any symptoms before. And we have we know there's a link between those type of fascial disorders, movement disorders, pain, as your body is changing, as these metrics of estrogen, and I'll let Dr. Liang talk about all that, when those start dropping, why our body responds with pain responses. And so in the menopausal medicine space, I have been really focused on how movement can help, and strengthening. We're going to talk about lifting and why strength training is so important for women too. So just a little housekeeping thing. If you guys want to ask questions, you will see, I just posted in there, but there in the bottom right-hand side of your screen, there are 9 dots that are kind of in Brady Bunch style. And you'll see Q&A in there. Click on that Q&A and you can just post your question there. Another option is there's to the left of those 9 dots, there's a chat box. You could also put in there. So I'll be monitoring those and sending those questions to Dr. Liang, or I'll answer them if it's PT based. But the big goal for today is that we want everyone to understand how results that you may have on an InBody scan, what that actually means for your health. Dr. Liang will talk about we're going to be talking about what body composition, why that matters, what the InBody reads and what that report tells us, kind of looking at some specific health insights, and then using the data to help you make some change. And we'll have time for question and answer as we go, but if you have questions that pop up, please just post them. So anything else before we get started, Dr. Liang?
No, thank you for doing all that multitasking.
Okay. All right, we'll take it away.
Okay, so So why do we want to know about our body composition, right? So, I mean, isn't it enough we go to our doctor's office and they get our height and weight and we get a body mass index? Well, it's actually a little bit, well, actually it's a lot different than what you expect. When we look at the body composition, we're not just looking at the numbers. We're looking at the physiology, the hormones, and how your body is actually adapting to your everyday life. So the woman's body, they shift naturally with hormones in many different type of periods, timeline in our life. It could be through our monthly cycle, for those of us still have our cycles, pregnancy, postpartum recovery, obviously perimenopause, which could be 5 to 7 years before your menopause. And lastly, your menopause and also with aging. So the hormones shift at different times and they can fluctuate. And they're doing it because that's their job. Physiologically, biologically, it does that. But when they shift, it changes the way we metabolize our food, how much water we retain in our body, and it also affects how inflamed we feel. And lastly, when we talk about muscle mass, it can also affect the way we maintain and build our muscle mass through the fluctuation of the hormones. But aside from that, we also want to think about stress, the quality of your sleep, how well your thyroid is, as well your blood sugar balance and gut health. All of that also play major roles in how our muscles and fats are distributed throughout our whole body. And that's why there's really, if you have two women with the same weight, they could feel completely different in terms of energy, strength, and symptoms because of all these other factors. The body composition analysis, the report, helps us to see what's going on beneath the surface, how our muscle mass is responding to how we work out, how we move, how well our metabolism is functioning, how we digesting food, how inflamed we are, and how much water are we retaining. When we starting understanding these patterns as we follow how the body composition report changes over time, we can see if we are improving as expected, where can we make tweaks, and unfortunately, are we declining? So it is really a roadmap for us to work with your physiology and how to adjust your diet and exercise to optimize the muscle mass in your body. So muscle is really, really important, right? Especially in a woman's body. We talked about the major things that it does. It drives your metabolism. It supports your bone density, and it stabilizes your blood sugar. So when you have less muscle, usually starting in our 40s and 50s, we're starting to feel fatigue. We're starting to gain weight. Despite we're eating well, we are going to be difficult to recover after we have a workout. And we're starting having these aches and pains, joint pain, and we just feel more inflamed and swollen in general. So just a little bit about muscles. It actually burns 3 times more calories than fat. So that means that if you have more muscle, you're going to burn more calories even doing nothing, just sitting there watching your Netflix. Your body will use your energy more efficiently, and it's much easier if you maintain your muscle weight or build it to just in general lose your weight or maintain your weight. But muscle have a friend. Muscles and bones, they work together. So the muscles are attached to the bones through tendons. And every time you move that muscle, it pulls on that tendon, and that tendon pulls on the periosteum, which is the outside surface of the bone, and it stimulates the bones to grow. So that's pretty neat. And that's why, in order to increase your bone density, you need to do weight training. You need to do weights, there's certain exercises like your strength training, your HIIT exercises, whatever exercises that could help your tendon pull on those bones. So that means that if you lose muscle, it's also easier for you to lose bone mass. So as we all know, menopausal women are at a much higher risk for osteoporosis, right? And women in their midlife, in their 40s, 50s, 60s, we will lose our muscle mass, as well as bone mass, if we don't do the strength training. So just remember this, strong muscle creates strong bones. So
And for those who want to know the stat, so you lose up to 10% of your bone density in the first 5 years after menopause. And 50% of women will be affected by a fracture as after going through menopause. So some fractures are more scary than the other ones, like a hip fracture. But the stronger, like Dr. Liang was saying, the stronger your muscles are, stronger your bones are, and will protect you from a fall, because you have that system protecting that bone density. Sorry, thanks.
yeah. Yeah, hop in anytime. Sometimes I just kind of run away with it, so feel free. And then also, just remember, muscle is also the biggest storage tank of glucose, which is your energy, your carbohydrates in your body. So if you have more muscle, which means that you're going to have less elevations of blood sugar. So your insulin, at which we take in our blood sugar to our cells, our sensitivity to insulin will be better, which means that it lowers your risk of diabetes. It's going to lower your midsection abdominal fat. Since your blood sugar is not going high and low, because it's more steady with more muscle, you will have less cravings. So anything else you want to add, Denise, before I go to the next slide? Okay. So this is the body composition machine. You see here on the bottom, the four metal things on the bottom, you have to go on it barefoot. And then the two arms that you see on the side, you actually hold on to it. So it's a body impedance machine. So it measures how the small amount of electricity is traveling from one part of your body to another, and how fast it goes through certain tissues. It tells, the machine knows, is it going through bone? Is it going through water? Is it going through fat or muscle? So that's how it compiles its data. And here's Denise, standing on the InBody. And we also use the word InBody, and I know that's a little confusing. The InBody is the brand of the machine. So maybe you can share your experience using the InBody machine, Denise.
Yeah, so she just had me get up on there, took my socks off and my shoes off, and had me hold it. And you can see that there's a screen. You can see that. It's going through saying how much longer. I think I was up there for maybe, I don't know, 30, 45 seconds. It wasn't long before the data came out. So it was painless. I didn't have to, I couldn't feel anything. And it was relatively quick to get the results.
And it talks to you, it tells you, don't have your arms touching your body. And then there's like this music that comes on as you're waiting for 30 seconds, I think.
Well, and it was cool because the results, it went through really quickly, some basic things, but then all of a sudden the report was printing. So it was quick.
Yeah. So this is the report. So it just literally, there's a printer right next to it. Once it's done, it just prints out the report. And there's a lot to decipher here. So we can kind of go through it and just see what information we can have from this one report. Okay, so I took snippets of that one particular report, and I wanted to just kind of show you what it actually shows. So first of all, the easiest thing to look at is when you look at a, for example, here's muscle fat analysis. What is average, which is the dashed line here with the red outline. And to the left of that, it's a down arrow. And to the right of that, it's an up arrow. So the dash where the red is, it shows you, it compares to a healthy reference range of women your age and size. So you could quickly see what's optimal, what's low, and what's elevated. So for example, here you can see this person, their weight seems to be average. But what's down here, I don't know if you can see, it says body fat mass, like 2 lines after that, it's on the above elevated side. So you can just skim through that and you can see where you are in terms of comparing to a population of women that is your size and age. And then the next thing I want to focus on is actually the muscle fat analysis. So it definitely gives you a weight, and this is easy to get, right? You can hop on the scale and get your weight. But the next thing it gives you is a skeletal muscle mass, which is how much muscles you have in your body. And the third category is the body fat mass. So how much fat do you have? Like, it's not just the fat that's you see that's like, like what we call like the love handle. It's actually, they also measure fat that's around the organs. And those are the most, I would say, dangerous, concerning fat, because I will explain a little bit later why is it concerning when a woman is average weight or underweight, but when you hop on this machine, what it actually shows. So with this muscle fat analysis, what I would look at is at the end of each measurement and how they lined up. So in here, you see the weight is 164, muscle mass is 73 pounds, and then fat mass is 35. So in this particular person, they lined up relatively okay. And as a matter of fact, their muscle mass seems to be protruding out a little bit more. So if you can imagine what shape this would be, it would be a little bit more like a D. Okay, so you can imagine like a D where it bulges more towards the middle. So this is good. This is actually a good example of now we have more muscle than fat, and it's in proportion to the weight. Now, if you would have the muscle mass, skeletal mass at 110, like, can you see it like right at average, then it would not be the shape of a D, because the curve would be protruding the other side. If you I don't know if you can see my arrow. Can you see my arrow when I do that? I wonder.
No.
No, can you see it here? No, right?
Oh, there we go.
Oh, you can?
Yep.
Okay, so, oh yeah, that's what you meant, toggle back and forth. Okay, so when you see the D, like if I draw this one here, that's a curve from the D, right?
Okay.
But if my skeletal muscle mass is here, then it would be a C. Oops, it would be a C. That would be a C, right? So you want to have a curve like a D instead of a C, because C means that you have, regardless what the weight is, your muscle mass is not in proportion, and then your fat is more than your muscle. Does that make sense?
Oh. So you want them all, and these aren't my results, just so everybody knows.
I don't know. These are not. Yours are bad.
But so the more, so what you, just to recap what you're saying, you want the skeletal muscle mass to be higher than the body fat mass.
Absolutely.
Okay.
But this is not what we see. This was a nice example from the InBody, but because their graphic was the best to paste on here. But yeah, so you definitely want a proportion. So if you could, what we want to get is actually, if you could just get an I. You see, if these lined up, there would be an I. So an I is okay. A D is great. A C that's something we need to work on, right?
I'm reading my InBody results as we're doing this, making
You really
C-shaped tools. Do you want an I or a D? Okay.
You're an I or D, not a C.
Right.
Okay. All right. Okay, so this is an example why when we go to the regular doctor's office, why the body mass index, which is the first role, is not accurate. So again, when I put somebody on the body composition machine, myself included, we always have more percentage of body fat than what the body mass index shows. So it's not in this example, but what I see is you would have an average body mass index, let's say like 22. So you'll be happy, right? You're like, oh, I'm not overweight. And then this person would have a percentage body fat all the way at 30. So, you know, because of that, I can attest of many women that I put on the body composition machine that the body mass index is not accurate. As a matter of fact, my mother is underweight. So I put her on here and she is 105 pounds, like somewhere like here. And then her body, a percentage body fat is at 36. So, and she's not the only one. I mean, I've done this on multiple women. So it's this body mass index, it is not accurate.
Well, we've known that forever. Like BMI has always been, I mean, I think BMI tells me that I'm obese. So, I mean, and I think you were one of the first people to say that is like, you can't base anything on your BMI. Because
you had a lot of muscle mass. I mean, I was very impressed.
So I think that, you know, it tends, these are the numbers that the doctors measure us at. Even Medicare with my patients, Medicare, one of the metrics is Medicare wants me to measure patients' BMI.
Yeah.
And I don't think that is a good indicator of health. Because like you said, you have your mom who's underweight, but she has high body fat.
Right.
So sorry to your mom that I'm using her as an example, but.
No, I was I meant to put her on here, but then again the graphic was just too blurry. It just didn't make any sense.
Yeah.
So, all right. So the next thing is the body composition machine. It breaks you into segments. All right. It gives you 2 arms, 2 legs, and a trunk. And in this particular segmental lean analysis, it obviously gives you average, under and over here with the arrows, but it also gives you the weight and percentage of each of the limbs. So, for example, we can see where somebody is having a strength issue. Let's say if the left leg, the arrows are like down up over here, and then the right leg is up there, you know there is an imbalance, body mechanic imbalance on this. So as a matter of fact, there was a 55-year-old woman who came to me and she said that she has not been able to exercise because she has a cartilage tear, a labrum tear in her hip. And we didn't really get into it because I popped her on the body composition machine, and then I wanted to talk to her. But then when the report came out and I said to her, is your labrum tear in your left leg? She's like, how'd you know? And I was like, well, that's the one that lost a lot of muscle tone. So, so it tells you the symmetry, right? So obviously mechanically, we want to be as symmetric as possible. It also gives you the ratio of extracellular water over total body water, which we'll talk about later. And then we'll also talk about phase angle later. But it breaks all the segments and it gives you these details, and which is really useful, especially when you talk about mechanics. Because you know, I'm sure Denise can attest, like when you have asymmetry and significant asymmetry in one limb to the other, you're just really prone for injury.
Yeah, and I think I love this. I love that people can see that asymmetry because it's a metric that we can measure then to say, listen, you know, the low back pain you're having is affecting your left glute strength, and you can see it in these numbers. So I do appreciate that these are actual numbers that give us objective data.
Yep. So want to talk about that ratio a little bit, the extracellular total body water. So the extracellular fluid is the one. So what do we want? We want our cells to be hydrated. So those are inside the cell. So we want really good intracellular water. When we starting having more extracellular water, that's when we're swollen. I don't know if you ever, those of us who known of people who have heart disease, who has kidney disease, or pregnancy. How when your ankles are all swollen, so you have like ankles. So when you put your finger on it, and it's like it makes a little dent. Those are all interstitial fluids. They are extracellular fluids. So we don't want that, because it's as a sign of inflammation. So when the index, this number elevates, it means that we're having inflammation that is driving the water outside the cells in the interstitial fluid. So a healthy ratio would be between 0.36 to 0.39. So you can see in this example that the legs have they're less healthy, right? In comparing to the arm and the trunk. And interestingly, if you look at the legs, it has less muscle than the trunk and the arms. So that reflects what's going on. So you may want to ask, ask yourself and ask the patient, like, what's going on? What have you not been able to use your lower extremity? This person could maybe telling you, well, you know what? I just had a COPD attack and I been bedbound, or I had pneumonia, I've been bedbound. So for, a month. So there's a reason why this is happening. So you want to kind of investigate. And if they cannot identify a reason, that's also when you make recommendations on how to strengthen the glutes and pelvis and all that.
So Dr. Liang, on the left-hand side where it says the pounds, like for the right arm, it says 4.39 pounds and then 99.3% up on the top right arm one. What that percentage is, what is that a percentage of that? Like, what should that percentage be?
It's a percentage of the muscle. Oh,
Okay.
in this particular percentage, I think they have to line up.
Okay.
To tell you the truth, this.
No, go ahead.
Yeah, I'm not quite sure. Like, I've only seen them line up. They correlate with each other. So I have to kind of look into I have to think about in what circumstances would the pound, like would the weight be much higher than the percentage, or vice versa? What does that mean? I don't know.
Because like my right arm percentage is 114. My left arm is 112, which would make sense. I'm right hand dominant. So is that good that it's 114%? So I just, but my ECW is 0.37.
0.37. So that's within, that's the ratio. So that's within the healthy ratio, right? 0.37. Yep.
Okay.
Because if the more edema you have, more interstitial fluid you have, the less healthy it is. It's more inflamed.
Okay. Thank you.
Yeah. But I don't know, in this case is talking about segmental lean. So muscle mass, I mean, I think in any segment you're over 100%, it's really good. Okay, let's see here. Oh yeah, so sorry, I forgot to tell you the symmetry. So ideally your arms should not differ more than 6%. So I don't know if you did a calculation on that. And then your legs should not differ more than 3%, because then it would be unbalanced. I mean, there is, like you said, dominance of a difference because of, dominance, but it shouldn't be like, like a 15% difference, and something is not right. Like you're neglecting one side of your body,
But did you say 3% for the upper body and 6% for the lower body?
No, the other way around. Arms 6% and then legs 3%.
Okay.
Okay. So the phase angle, I think it's a AI calculation that they've done in all their readings, and they came up with a number at which it actually shows cellular health. So our cells produce energy through the mitochondria. So that's how we metabolize. That's how we use oxygen to metabolize fat, protein, carbohydrates. So the more efficient our mitochondria is, the better we are in terms of recovery from exercises. So I know this actually really, really well because my mitochondria, the way that my body recover from exercise has never been the same. So I actually had breast cancer when I was younger. And I don't know, is it the chemotherapy or the radiation or a combination of both? My mitochondria has never really been the same. And I've been working on it. It's been very difficult for me to work out. Even sub max intensity and not be able to feel like a lot of like really, really sore for like the next 5 days. And I know it shouldn't be 5 days. I mean, maybe a day or two, but there's a recovery issue. So it's the efficiency of how well your body makes energy, and also how well the byproducts, when you make energy, actually byproducts come out. When you exercise, when you sweat, when you have lactic acid, and how well you can get rid of the byproducts. So this phase angle number should be a healthy range would be 4 to 6.
I'm a 6.1.
Oh, okay. The higher it is, the better it is. So you don't want to be 3.9, you want to be 6.1.
Okay. It makes
So
up
this
for
is
my
like
in
really, really
shape.
good. Yeah. This is really, really good. Yeah. Are you still running like long distances?
Not more than like a 5 or 10K.
Okay, I mean that's still something. Yeah,
Well,
no, you're
I've been doing more lifting than cardio, so this is why this is interesting to look at this.
sounds like you're recovering really well.
Well, I
Do
just
you
got to
feel
fix
that way?
my shape now.
You don't.
I want an I or a D.
Well, we always thrive for something. What's
That's
life
right.
like without
Right.
thriving for something, working towards something. Okay. So so we talked about so it also gives you a history. So if you go on the body composition machine, it gives you a history. So it gives you like the date where you got your first reading, which is on this column. Second date, like you see how this is like September 15, this is October and November and then December, and it breaks it down for you and you can see how it changes. And that's how we use the machine. It's really, we're not there to, shame anybody or just say, look what you've done or not done. It's about you making progress and how we can guide you to get better. And it's also really nice to see that you're making progress. I mean, I think it's a really good motivational tool.
And it's based, and your ID is your cell phone or your phone number. So
Yeah.
if I did an in-body scan with you, and then I was out in California and I had to do a scan out there, would it be the same thing? And it would track my results because it's tied to my phone number?
I believe it's the same thing, but you can get the app, and that's you're gonna retain that. So that app on your phone, it's definitely gonna identify the same person.
Okay.
I would think it does. I've never done the InBody in any other place, but there's only one phone number, so it's a unique identifier.
Okay.
Are you not coming back to me to get another
No,
reading?
I am. I'm just wondering, like, I just wanted to say that it was tied to my phone number and not to the machine.
And it does a QR code too, right? Like I forgot to tell them that like once you're done, like your report has a QR code and you just scan it, and then the report comes through an email if you want, and then you can get the app, and then the QR code ties the report to your identity on the app.
Okay.
So this is another segment. Remember we talked about how water is being retained in the body. There's intracellular water, there's extracellular water here. So you definitely want, if you want to just kind of take a look, just skim through, in this particular person, you have more intracellular water than extracellular water, which is what we want, right? But when you start seeing a shift of, let's say somebody is on prednisone, like, they might have sciatic pain or somebody gave them prednisone, or they have rheumatoid arthritis and they've been under a low dose prednisone for a long time, they will start retaining water, right? So you can actually see a shift from one InBody reading to another, that the intracellular fluid and the extracellular fluid will start shifting. In terms of like, would it be all arms and legs and trunk? Is it all of these? I'm not quite sure, but I guess it's all depending on where they're retaining fluid. But if they had an injury, then to that right arm, then definitely it would just shift at the right arm in both areas. Okay. And then lastly, this is your visceral fat center. So remember we talked about the fat that's around our organs. Those are like the more dangerous fat. So they map it out for you. And this is measured at centimeters square. So if your level is above 100 centimeters square, you see how the top is like sort of like concerning zone. And then if you're on the bottom is, I would say, healthy zone. So if you're more than 100 centimeters square, then you would be at a higher risk for metabolic disease. So this is really important when we do hormone when we have transitions in our hormones and fluctuating levels. We just want to know, we obviously don't just go by this, but this is one tool just to say that, wow, you have more visceral fat than we thought, even though your body weight is normal or you're underweight.
I'm at 111.
Okay.
So I'm above the 100, so I'm at risk. Though when I had this done 5 years ago now, 6 years ago, I was at 122. So
Oh, you found it?
Yeah, I found it. So it came down.
See, it's about progress. It's
Yeah.
really, and 5 years ago, you were less perimenopausal than now, right? So your hormones were probably much more normal than it is now.
Yeah.
So that is huge progress. If you think about, so you have to really compare, you really have to look at the external factors, right?
Okay.
Okay. So to protect our build muscle, I just have an outline here. I think this part, Denise, can actually build on that because I know that you do a lot of patient education. So obviously we talked about strength training. And then you always want to optimize your protein intake. Must. So whether you're a vegetarian, vegan, or you just eat carnivore diet, try not to have too much animal fat. It's just that the fat quality is just not great. I mean, but just make sure that when you have meat, it's, pasture raised, grass fed. The fat quality is going to be different. So it does say here, I listed, you should have at least 30 grams of protein per meal. But to maintain your muscle tone, actually, you have to do the number of grams per pound. So per day. So for example, if you're 140 pounds, you should eventually, not at first try, the first week, you should eventually go up to 140 grams or 120 or around 140, so 120, 140 grams of protein per day to maintain your muscles. But I don't recommend them starting saying, okay, this is my first day of doing this, I'm going to do 140 grams, because your body's not going to like it. You're going to have issues absorbing it. You're not going to feel well. And then it would discourage you from taking more protein. But just kind of remember, you need protein. And it's not just building muscles, your antibodies. You can't fight off viral infections, bacterial infections, your receptors in your body, everything needs protein. So it's really, really important. And then the third thing is really prioritize your sleep quality. I know that a lot of us, some of us say, I only need 4 hours. I need 5 hours. But I think that if you could just kind of, even if you're not asleep, but you are resting, so sort of just give your body a break. So do you have anything to add about all the three pillars? Yeah.
So I put my saying there at the bottom of lift heavy shit. I think that the recommendation of how to work on building that muscle mass so that you can help drive your metabolism, so that you can help stabilize the blood sugars and protect the bone density. We're not talking about like 2-pound weights or 5-pound weights. We're talking heavy stuff. And so my recommendation is always work with a trainer or a physical therapist to learn the technique first, because you don't want to be trying to do squats with heavy weight and it's either too heavy for you or you don't know the proper technique and then you get hurt when we're kind of at risk for pain anyway during this time. So the recommendation is, I think in college it was like cardio for me. So I thought I need to just be doing cardio. I've been running. Should I be running more? Should I be swimming more? I need to get my heart rate up. And what I found is I was actually not losing any weight when I was going back to that cardio intensive workout. And that's in doing research, started finding out that you have to start lifting heavy. And so what I always tell everybody is cardio is really important for your heart. It's cardiovascular health. So making sure you're doing cardio a couple times a week, because I think we want to train our heart to be able to elevate our heart rate, to elevate and then recover. That's important for cardiovascular health. And I think cardio is also good for stress management. Like it does feel really good still to go out and run a 5K as fast as I can and just sometimes burn some energy of emotion. But then making dedicated time that you're lifting 3 to 4 times a week. And 1 or 2 of those sessions should be with heavier stuff. So I work with a trainer twice a week and she makes me lift heavier than I would think. So if I were at the gym, I'd be like, all right, I'll take a 25-pound weight and I'll do some squats with it. Well, she put 165 pounds on me my last time, which was a huge number for me. And I didn't want her to tell me what my number was till I was done lifting. But to be able to lift that much weight, like I would have never programmed myself to lift that much weight. And I wouldn't have felt safe doing that much weight in the gym by myself. So, but if I do go to a gym, I know that I could probably lift 100 pounds in a rack. It's called the Smith rack, or I call it the Denise rack. But it's one of those racks where if I had to step away, it's within the system, it's in a track, so that if I were to have to step away because I failed, it wouldn't hurt me or somebody else that's helping me lift. So you have to learn to gain confidence with lifting. And that's where I think working with a trainer or a PT will help you gain the confidence in the movement and understanding how to program yourself. If you've already been lifting and you've been lifting, using 10, 20, 30-pound weights, that's really empowering to be able to move that much weight. So don't be afraid to lift heavy. You're not going to bulk up. Everyone thinks they're going to become like huge. We're not doing those types of workouts. When you're lifting the heavy shit, you're only lifting 4 to 6 reps. You're not having to do like 3 sets of 20. So one of my days, well, actually now 2 of my days, I lift heavy stuff. So I'm doing 4 to 6 reps of heavier stuff with my trainer. And my 3rd day of lifting is a lighter weight, but higher reps. So maybe I'm doing some bicep curls, but I'm doing 3 sets of 15 of that. And my heart is still reacting to that. I wear a heart rate monitor. I can see how much my heart rate is spiking when I'm lifting some of this heavy stuff. So I don't want people to be afraid of lifting heavy because it's actually really empowering. And I like how I feel. Before Dr. Liang had me take the body composition measurements, I was using a tape measure. And I think I've lost 12 inches in a year. My scale hasn't changed that much though, because I'm building more muscle, but I'm 2 dress sizes down and I'm fitting into shirts and pants that I wasn't fitting into before. But if I were to only look at my scale in my bathroom, I would feel very defeated. But when I look at how much I'm lifting, so I keep a log because I need some kind of motivation. So I keep a log of how much I'm lifting, of what the amounts I'm lifting. I keep a log of my tape measurements. So I measure at my stomach, I measure just under my boobs and right above my, just below my belly button where I tend to store the most fat. And so even though I don't see the scale changing, I see those numbers, my tape measure is getting closer and closer. And so, and my dresses are fitting better. And that's the stuff I've been using to make myself feel better. Because otherwise, if I just looked at the scale, like I said, I'd feel super defeated. And now that I have these metrics from the InBody, I have very specific data. And as a PT, I like this kind of data. So I think that journaling, I'm not a person who tends to like write lots and lots of pages on journaling, but I like metrics. So I like to say that I was able to lift 165 pounds on my back squat and what that felt like to be able to lift 110 pounds in my bench, and how that made me feel. And so those are just quick jots down that I can see my progress and not feel bad. So the strength training is key. And again, I work with a lot of athletes. And so we always feel like we should be doing more running and more biking, and that's good too. Again, use that for your heart, use that for stress management. And I get the one question I get all the time is about weighted vests. That is not the same thing as lifting heavy. Your weighted vest may be 20 pounds, which is great. And that's great on your walk because it's going to help elevate your heart rate. So don't be afraid to wear the weighted vest, but know that that's not enough weight. It's a great place to start and you should use it. And if you bought it, go ahead and use it, but also maybe do it with some step ups, like step up onto the second stair of your stairs and then step back down. Work on like step ups, work on squatting with it. Don't just wear it when you're walking or when you're working around the house. Use it when you're actually like, do some push-ups with that. So weighted vests are awesome. You just have to make sure that it's not the only thing you're doing for weight. And we can talk more about this if anyone wants to talk offline on some programming ideas. I can help you create your own program, but it's something that can be very empowering and not intimidating.
I also use weighted wrist things that you wear so that you could put dishes away. You could like tidy up with like,
Yeah.
that's out.
You still need to lift heavier than that, Dr. Liang.
I know. My 1 pound weight.
Yeah.
And then here you are, like, I lifted 165.
Yes, but I've been doing this for a year. And I had a trainer who, so that's the thing is that I've been doing this for a year now. And so I couldn't lift 165 pounds when I started in January.
Mm-hmm.
But with time and with education and training, I can do it.
Mm-hmm. Great. Okay, lastly, just want to talk about a little bit of hormones. We want to understand how these guys play with each other and how they kind of change over time, right? So estrogen is really important to build and maintain muscle. And that's why in menopause, when we have lower estrogen, we're starting to lose muscle and along with aging. Now, estrogen, interestingly, perimenopausal women, it is the fluctuation of the estrogen that's giving them the symptoms. So they don't necessarily have lower estrogen. It's really about the widespread. Sometimes it spikes, sometimes it lower. That's when they start having some symptoms. It's very important for strength, bone health, metabolism, and that's why we tend to have blood sugar issues, insulin resistance, osteoporosis when we're in menopause. Now, progesterone, I would say progesterone is actually my favorite hormone if I ever could choose one. So progesterone calms you. It actually balances your estrogen. So many times when people say I'm low in estrogen from menopause, the really, I would say half of those people are right, but then they also forget to mention that is because their progesterone is lower, so it's not able to balance out the estrogen because they have to play with each other. It is the balance of these two hormones that that really makes a really good harmony for our body. So when we are low in estrogen, we will notice more anxiety, mood swings. Our sleep gets lighter, and then it's harder for us to recover from exercise. And then, go ahead.
No, that's interesting. I didn't know that part.
Yeah. Progesterone is my favorite. Actually, there are people who prescribe progesterone for men with andropause. I don't know that the term is like the men as they age, they have lower testosterone, but they have,
Menopause?
so we call it andropause.
Oh, I like menopause.
Menopause. And they give a little bit of progesterone at night so these men can sleep better. So that once they sleep better, their cortisol level lowers or have appropriate pattern, they actually function better. So lastly, is cortisol. We all know that when we have stress, cortisol goes higher. But really, it is the pattern of cortisol that's really important. So, I think that a lot of times we want to explain to people high is good, low is bad, or vice versa. But it really is the pattern of certain hormones. So cortisol is supposed to rise up in 30 minutes when you wake up, and it's supposed to slowly come down, like decline, and then it's supposed to go the lowest right before you go to bed. So any change in that could really affect your sleep, the way that you handle stress. As a matter of fact, the more cortisol that you produce because of stress, it takes away the building blocks for your estrogen and progesterone. So that's why it's so important when you think, okay, I'm low in estrogen, but maybe we have to think about your progesterone. But no, even if we supplement, even if we give you estrogen and progesterone, but we're not understanding how much cortisol is playing into this, you're really not getting to the root cause. Because if cortisol is there, it's just going to keep on taking out the building blocks and make more cortisol. It's not going to go to where you want to go.
So cortisol, like you can be given some medication for progesterone and estrogen and testosterone, but there's no like medication to regulate cortisol. Is that correct?
You can have DHEA, you can have that, but which is a precursor. But again, if your stress level is high, where is that building block going to?
Yeah.
It's just going to go to cortisol, right? So it really is important to go upstream, and we always look at the sympathetic drive. How much are you in fight or flight response? Because that is a game changer.
I don't know how I know my cortisol is really high, but like I own my own business. I have kids that are in high school. Like I'm involved in the community, and it's all stress that I like. I mean, I don't feel bad. I don't feel like, oh my God, the weight of this is killing me. But I do feel like, and I know a lot of women feel this way, like I can't change that. I can't change that. I also have aging parents. So what are ways that, other women can bring those stress levels down? I know that's why sleep is so important. And finding happiness in like reading or something else to like lower your anxiousness too. But there's no medication necessarily, which I don't think everyone should just take medication to fix things. But what else would you recommend for women to get those cortisol levels down?
I think it's very difficult to come up with, because everybody's time is different, right? Like you said, but I always think that practicing gratitude is really, really important. Even if when I see somebody and they are super busy, they have little kids and they have, if they have parents they have to take care of, sometimes just spending that 5 minutes when you wake up to do some deep breathing, and the same 5 minutes before you go to bed, and changing your sleeping habits. Try not to have electronics, and I might be a hypocrite in this because I own my own business now, so I'm on electronics all the time until I go to sleep. But try not to have electronics an hour before bed. It's easy for somebody to say, well, don't stress out, but it's life, right? But if you look at things a little bit more differently, if there are obstacles in life, try to stop yourself and just think about, well, it's bad because of this, but then you can always find the other side. It's bad now, but what if in the future it's good because of the bad? So when you start to, I would say, rewire your brain, it gets in the habit. Remember, like whatever we do, it gets better with practice, right? Working out, right? You can lift more and more weight. Learning a skill, learning how to play violin, learning how to play guitar, you get better as you practice on it. It's the same thing with the mind. So instead of saying I'm going to go and practice physically on something, you should have some practice on the mind. And it doesn't really take that long. Like I said, 5 minutes just to lower your cortisol level. And sometimes when I used to work for somebody, I would, in the middle of the day, when I have that 5 minutes to eat, I would spend like 2 minutes just to breathe, if I remember, but I would stay with that and be kind to yourself. It's okay that you're not doing the things that you expect yourself to do, whether it's a self-care or whether is it you're like, oh, I'm not there for my kid, because they have a need or they have something that I can't go. But just be kind to yourself and forgive yourself. Just small things like that. It makes a huge difference.
It's good advice.
Okay, so just want to say something. This is not a grade. When you get this report, it is not shaming. It is a roadmap, okay? Remember your muscle recovers, okay? Your metabolism adapts. You don't always have a slow metabolism. And your age, it's not your barrier to progress. And I say that with my most sincere self, okay? Once you understand what's driving your symptoms, whether is it a hormone, whether is it a mitochondria dysfunction or muscle loss, you will be empowered. Okay, you will have the motivation to change. And you're not going to be perfect. You're not going to make all the changes that somebody suggests. But again, self-forgiveness and give yourself space is really, really important. So this report is about clarity. It's not judgment. It just gives you the information so we can help your body feel better, stronger, and calmer, and more resilient. Okay?
That's great. All right, so we have one question. What are the best ways to measure the estrogen and progesterone and the cortisol hormones? It seems like a blood test is just a single moment in time and not super helpful.
Very, very good question. So you can track trends, but in perimenopause, your trends are not very accurate, right? Especially when you go to talk about LH and FSH, which is something that stimulates the estrogen and progesterone. So there are specialty functional tests. There are companies that make them. They look at the hormone metabolites. So this is actually quite important. So I took one because I had a history of breast cancer. So I wanted to see how is my hormone breaking down each month. And because certain metabolites are more harmful than others, they could damage your DNA, give you a higher risk of breast cancer or endometrial cancer. So I usually, for my patients, I use the Dutch test, at which you collect a samples of your urine. So you could do 4, but if you can do 5 in the middle of the night, it's even better. It measures metabolites. The report comes out to be like 30 pages. We look at these individual markers and we can see how well you're metabolizing them, what's missing. Should we increase certain food, or do you need like supplement for a short time to kind of drive the levels on certain ways? And the good thing is it also gives you the cortisol curve. So because it's a 4-point to 5-point urine collection, it will measure the cortisol level throughout 24 hours. That is not the gold standard. I just want to say the gold standard is you collect your urine for 24 hours, but that is not really practical. This is really, really good. I mean, they compare it to the gold standard. This is almost as good.
Okay. I don't think we have any other questions that popped up right now. My question would be, when you get the results, so like if I see on my body composition scale that I am in the C shape, so I want my it looks like my skeletal muscle mass, I still need to bring up and bring my body fat mass down. So looking at lifting more, making sure I'm prioritizing protein, maybe working with a dietitian. And actually, we have a dietitian now that is sharing space with us here. And so I asked her tonight, like, would she do a talk with us on understanding why you should be eating the protein and helping you understand that part? And she said yes. So stay tuned for that. Because I think, you know, learning other ways besides weightlifting, what else can we be doing to help change some of those numbers? And so my question would be, how, if I start prioritizing protein a little bit more than I do in my sleep and working on my cortisol levels and stuff, when would be the next time I do this test? Like, do I give it?
I usually, if you are putting effort into, I usually would do it in a month. I wouldn't do it too early because sometimes the changes are not as apparent and we get discouraged. I would wait at least a month if you're consistent. And the other thing I would like to bring up is that, you know, it's all good and well that we take in the protein, but there are nuances I think we forget to mention, like how well are we really absorbing our protein and our vitamins and nutrients, right? We talked about like digestive enzymes, but something even simpler, like, are you eating on the go? You know, are we meant to digest well when we're on the go? No, right? If you look at our animals, you look at how they eat, they're always in a calm space because that stimulates the absorption of the gut, right? So if you are eating on the go,
walking into the
like
room,
gobbling up, like, you know, let's have a contest. I can finish this in like, you know, 5 minutes, like a big meal. If you're eating on the go, you're not digesting. Your body, you're not sending signal to the body that this is a calm environment and you can put the energy of your body to absorb food. So if you are taking the protein and you want to take more protein and you're chewing your food, I would suggest just about to swallow, chew it 5 more times, right?
well, that's what you told me. You said chew it 5 or 10 more times. I've been trying to do it and I can't. Like, it's so hard for me to slow down. I just need to slow down.
Yeah, yeah. Because you have to give your body a chance to absorb it. And then also, if you don't slow down, you're in some way telling your body that not that it's very, you know, a big danger is coming, but it's in a fight or flight response, right? So it's not going to use all this energy to absorb the good stuff that you're eating, you know, no matter how great the stuff is. So it's really important to honor our sleep and honor our meals.
Okay. Well, and it looks like you are offering a free body comp reading or scan here.
Yeah, you can scan it. It goes straight to the schedule. So you can just book it, or you can just call the number and then we can book it for you.
Thank you. And we'll send this out with the follow-up info from here. So I appreciate you offering that to everybody. I think that's great because I think, and then to be able to sit with you, you know, if they wanted to then schedule time with you to go over the results and, you know, maybe get some additional testing on what their hormone levels are. I think that's really an awesome way to start understanding what your body is going through. So thank you for offering that free scan.
Sure.
And if anybody has questions, let me know. You can email us separately. We'll send, you know, the follow-up from today. Just email me back. Let me know what questions you have, and I can either ask Dr. Liang, or if it's something that I can ask or I can answer, I'll make sure to get you that info. But so thanks to everyone for coming on tonight. And thank you, Dr. Liang, for your time. I know you're busy starting your business and growing it, but you know, your expertise and your friendship here has been really supportive of how we treat our patients. And so I'm grateful for your time and effort.
Oh, you're taking the words out of my mouth to speak to you. So, and thank you. Thank you for you and your team for, you know, sharing the platform with me. It's been really fun.
Well, all right. So everyone have a great night. Let us know if you have any questions, but we will see everybody soon. So thank you very much.
Good night.